Hey, thanks for stopping by the Kindle Chronicles. I've got a great show for you today. This is Len. Today is July 17th, 2020, and I am coming to you, as always, from Ocean Park, Maine, looking out at a calm sea toward the end of the day. And this week, you will hear again from A.G. Riddle, author of Pandemic and Other Science-Based Thrillers. Jerry Riddle this is his third time on the show talking about the pandemic. The first was back in March. We were still in Denver, I think, trying to figure out where to go and what was coming. And it has been a couple of months since we talked to Jerry last, so there's an opportunity to catch up with where things stand now. And I've been reading a lot of really pessimistic things about what's ahead with the pandemic, but when I got through talking with Jerry this time, I felt more optimistic. And his knowledge of pandemics, which came from his writing and the research for his book and just his following things like a scientist. I mean, he's a really sharp guy who's interested in these things. I find it a good complement to what I read in the media and goes a little deeper. So I hope you'll find it useful. I'm also going to talk in the news about a couple of health-related stories. It's been intriguing to me to see what Amazon has been doing, a lot of it fairly quietly, and in the case of the partnership with Berkshire Hathaway and J.P. Morgan Chase, actually quite secretly, and there's some news on there that I just didn't even know had happened, so I'll tell you about that. And I have a tech tip from Poland that is following up on something we had on the show last week about how you can gather articles and have them show up on your Kindle. Let's get started. The two news stories that I read this week about Amazon's health initiative were 2 days apart, and it turns out that they probably were related, as you'll see as we talk about this. The first one was on the Day One Amazon blog on July 14th, Bastille Day, my cousin Peter's birthday, and it was the announcement of something called the Neighborhood Health Center Pilot Program with Crossover Health, and the idea is to establish local health centers near Amazon fulfillment centers and operations facilities across the U.S. The first of these is being located in the Dallas-Fort Worth area, where Amazon has more than 20,000 employees, including 11,000 operations workers. Crossover Health, the partner for Amazon on this pilot, is a national medical group, and it provides these kinds of services to other employees, the idea being to connect every employee and their family to an integrated care team delivering comprehensive primary care. The initial phase of the pilot envisions 20 health centers in 5 cities. This would be affecting over 115,000 employees and families at Amazon. The cities will be Phoenix, Louisville, Detroit, San Bernardino, Moreno Valley in California, and Dallas-Fort Worth. If this pilot succeeds, they will roll it out to similar facilities in other states. There is a quote from a name I haven't seen, an executive, Darcy Henry, who is Amazon's Vice President of Human Resources, which gives a feel for kind of the corporate view of this. Across the U.S., an increasing number of patients do not have easy access to a primary care physician and instead utilize emergency or urgent care options, which is not only more expensive for patients, but also overlooks important preventive care opportunities. We want to solve that for our employees, and the launch of these new neighborhood health centers will provide a range of quality primary care services for employees across the country, further strengthening Amazon's industry-leading benefits program, which provides comprehensive health care for employees starting on day one of employment. They took the opportunity in this blog post to highlight some of the other employee benefits, and I think it's worth just recalling these. Some of these I knew about, others I frankly didn't. We all know about the $15 minimum wage, which when that came out, even Senator Bernie Sanders praised it. There's also full health, dental, vision insurance from the first day on the job, and that policy is the same whether you're Jeff Bezos or you're the most recently hired person in a fulfillment center. They also have 20 weeks paid parental leave, infertility and adoption benefits, and you can share paid leave with a spouse or a partner. There is a new family care benefit through an outfit called care.com, and this is related to the current crisis with the virus. It's being offered to 650,000 full and part-time Amazon and Whole Foods employees in the U.S. It includes 10 days of subsidized emergency backup child or adult care between now and October 2nd. And what's involved is a copay of $25 a day for in-center day care or $5 an hour for in-home care. I guess that's the copay. And Amazon is going to cover 90% of the cost. The Career Choice Program has been talked about. It's good to know these aspects of Amazon. On Facebook a while back, an old high school friend of mine spotted me holding an Amazon cup in a photo of me and Sophie, and he wrote just a really snarky post on Facebook about how much he hated Amazon, and Amazon was rapacious and this is that. And I don't know. I mean, I'm not so drawn to defend Amazon in every fight, but I just thought, well, I'll put some information out here. I said, well, actually, Bernie Sanders praised Amazon's $15 minimum wage, and I think a lot of us are grateful that Jeff Bezos revived the Washington Post in time to cover the current crisis. And those two things alone, maybe are worth considering. And my friend Jeff, to his credit, he wrote back and said, oh, I was just kind of, fooling around, or he was apologizing for his Amazon tirade, just in the face of a couple of facts that I was able to point out without being, argumentative or thinking, well, no, Amazon's great. It's just like, well, did you know that? And in this case, did you know Amazon gives 20 weeks paid parental leave and et cetera? So I find these summaries of facts about Amazon to be sometimes useful when the topic comes up. Now, returning to healthcare, the second story, which was published 2 days later, July 16th, was titled, What's Ailing an Amazon Health Venture by Paris Martineau, and it was published in The Information. I'll tell you more about The Information when we get through considering this article. And this is a description of Haven, which is the joint venture Amazon, Berkshire Hathaway, and J.P. Morgan Chase, and really quoting a lot of unnamed sources, anonymous sources, past and current employees, to paint a picture of how this very promising initiative that was announced with Jeff Bezos and Warren Buffett and Jamie Dimon, that it actually has kind of petered out, it looks like. And the thing that I didn't know was that Atul Gawande, a guy I really respect for his writing, he wrote the book Being Mortal. In May, just a few months ago, he stepped down after being the CEO of Haven for 2 years. And this article reports that it was actually, he was under pressure following pressure from the board, which is made up of representatives of the three companies. That's from a source. And this story says that the board was frustrated because Haven had a lack of progress on a key data platform project that was aimed to use aggregated claims data from employees to come up with cost-saving insights. The article says that over the last year, Haven faced at least 2 rounds of layoffs, budget issues, blows to morale, shelving one of its biggest projects. And also that Amazon was slow to act on projects related to Haven. The one pilot project that's described in the article was involving Chase employees, and then later it was going to involve Berkshire Hathaway employees. There had been overtures to Amazon saying, we hope Amazon employees in this Columbus, Ohio area would participate, but apparently that had not actually taken place. Before he left, this is actually quite a while ago, in 2018 at the Aspen Ideas Festival, Atul Gawande said, "My job for them is to figure out ways that we're going to drive better outcomes, better satisfaction with care, and better cost efficiency with new models that can be incubated for all." That is a tall freaking order. But what they're saying for me is resources won't be the problem. Human behavior will be, and achieving scale will be, and I couldn't be more delighted. That was in his more optimistic days. I think what I read between the lines here and connecting these two articles is that it turned out to be a bigger challenge to create a partnership between these three companies on such a gnarly issue as revolutionizing the healthcare industry than was anticipated. Meanwhile, Amazon has been doing some work itself, as was indicated in that earlier story, where they're setting up their own centers, doing similar work to what Haven was apparently working on. Probably somewhere along the line, they just got the feeling that it wasn't meeting their needs, or it didn't meet the original vision to stick with the trio of companies. And then the pandemic happened. And as we know, Jeff Bezos, in the letter to shareholders, announced that Amazon is going to be spending $4 billion to make the workplaces at Amazon totally safe within the coronavirus environment, and that there's a lab that they're developing for tests. And I think that if there was a drift away from this partnership, which might have been moving a little too slowly, to Amazon pretty boldly going after innovation in this area, the pandemic just accelerated it, as it has accelerated so many other things. In this lengthy article in the information, attempts were made, obviously, to get people to comment from the three companies, from Amazon, from Atul Gawande, from Haven. Nobody would have any comments, but they got the story anyway, and apparently a lot of digging, a lot of sourcing of this with current and former employees, with the result that we finally get to see what was going on with this very secretive initiative because of the reporting. I was familiar with the information because I interviewed Nick Wingfield. I think that was probably about 2 years ago, because he left the New York Times in June of 2018 after 7 years being the tech correspondent for the Times. He covered Amazon, Microsoft, and the Seattle tech economy. And we talked to him just before he was leaving. It was very interesting because he had some insights about Amazon. And I always thought that his coverage for the Times was some of the best of anybody that had been assigned to the Amazon beat. And he said, I'm joining this new startup called The Information, and it was founded by Jessica E. Levin, founder and CEO. They have quite a masthead of reporters now at this point. And when I saw this article, I have been curious what's going on with the Haven project, and it looked as if in the first couple of paragraphs that I could read without subscribing that it was really going to be worthwhile. So I said, okay, I'm going to sign up for the $10 a month 3-month trial, just so that I can read this article. And now I'll have it for 3 months. I put on my calendar that when the $10 a month rate ends, because then it jumps up to $39 a month, or you can get a 1-year subscription for $399. Maybe by then I'll be hooked. But I think it's a valuable technology source, and the approach that Wingfield always took to Amazon, I thought was balanced, and it was intelligent, and it was probing, and it showed that real news and real journalism takes work, and perhaps it takes new forums. I don't think the Information is taking advertising. It's being supported by subscribers, and I'm glad to see that it's thriving, and it's generating really useful stories like this one about Amazon and its health initiatives. I've got a tech tip that was sent in by Shimon Schott from Krakow, Poland. Dear Len, in today's episode you mentioned getting articles from Pocket to your Kindle. I used to use an alternative method called Croffler, Crofflr, which worked really well until the, quote, mark articles as read, unquote, feature stopped working. Now I've moved to Instapaper, which has built-in support for sending you a magazine, quote unquote, with your articles, up to 10 in the free version. The good thing is the available interaction. The magazine has links inside which work through Kindle's experimental browser so that you can archive or link both individual articles as well as the whole received bundle. You can also schedule a weekly delivery of this magazine. I recommend you try it out. I had intended to try it out, but as this got to be a very busy week with some projects I'm helping Dad with, I didn't get to try it out. I think in the past I have used Instapaper, but I'm sure it's developed a lot since then. And from Shimon's suggestion here, it would definitely be worth trying out. As I thought about the idea, I think that the hurdle that something like this takes, and so you get Instapaper, you set up your feed, and you do all this stuff, and I bet it's a nice package that you get. Meanwhile, by subscribing to Apple Plus News on my iPad or my iPhone, one little click, and I'm getting a very colorful, nicely curated section of news, which is kind of addictive. They're always updating it, and I'm pretty frequently checking to see what's new. That's what something like this Instapaper or the earlier Pocket thing is up against. It's sort of a do-it-yourself way to send material to your Kindle that would be curated precisely to your keywords or however else you're going to do it, versus something that has got some built-in AI. It sort of knows where you are going to, and it's gradually learning your tastes. So it's just like one click. You don't have to set anything up, and it's always being changed and always quite readable. But, two different ways to go, and I appreciate Shimon sending that idea on the more of the do-it-yourself side of getting a feed to your Kindle that is useful. He ended, as for the next guest, I would recommend Alex from Standard eBooks. He was a good guest, I think, about 3 years ago. Does a nice job fine-tuning public domain books and making them really excellent ebooks. Or A.G. Riddle. It's always nice to hear from him about the pandemic. And sure enough, that suggestion arrived in time for me to reach out to Jerry and get this week's interview set up. So thanks for that, Shimon. And let's see, 9 o'clock, you're probably asleep now in the middle of the night in Poland. Time now for the interview. I spoke with Jerry Riddle on Wednesday of this week. We had a good Zoom connection between Ocean Park, Maine, and Raleigh. And I'd done my homework by catching up with some of the data since the last time, and here's the conversation that we had. Well, I get to where I'm nervous when I count back the days to when we last talked, and what a much better world it was then. But it's
not going in the right direction.
Oh, it's definitely April 15th. U.S. number of cases stood at 834,000 with 60,000 deaths, and the current case count is in the U.S. 3.4 million and 136,000 deaths. That's obviously going in the wrong direction. One thing I noticed in that, and I'm not sure if I'm making the right calculation, but if I just divide the deaths by the total cases, in April, that worked out to 7.1%, and now it's 4%. Is that actually showing that the rate of death compared with the number of cases is declining?
Yeah, I mean, the thinking is case fatality rate is going down, and some of that, the question is why, right? I mean, some is, an overwhelmed hospital is obviously going to have a higher fatality rate. And then if you have some viable treatments, that's obviously going to potentially decrease the fatality rate. And then it depends on your patient mix, right? Like if you have an older cohort that is sicker, they're going to do a lot worse than, say, people in their 20s or 30s that are reasonably healthy. Mm.
I thought I heard something maybe on a podcast that a normal path for a virus in a pandemic is it gets more contagious and less deadly because the people who get killed can't spread it to other people, and that if there are mutations, they naturally get less deadly because of that.
Yeah, right. Yeah, any virus is going to throw off vectors that are, a little different. And you're right in that, the deadlier strains tend to spread less, generally speaking. And that could be some of what's happening, although, sequencing the genome of a virus is a pretty simple thing. And I haven't heard if they've sequenced something that they think is a principally different virus, but that would be interesting to know.
Yeah. Well, and the other statistic that is so depressing to me is the U.S. has 4% of the world's population, and we've got 25% of the coronavirus cases. When you look at us compared with how the rest of the world is dealing with this, what are we doing wrong? Why are we in this fix?
Now, that is a very good question. I think there's a few things. I mean, for context, America is obviously a very affluent nation. We're also a very large nation. So, to have a nation that's very spread out geographically with obvious urban density, when you look at places like Singapore and Japan, you expect to see a lot of cases. South Korea, same thing. But these places, Japan and South Korea, for example, have done quite well comparatively. I think there's a few factors here. One is, I think, the political environment in the United States. And the virus is something that, in my view, should be seen more like a natural disaster or a foreign war that we're fighting. And the question should be around how to fight it together. But I do think the virus is, in the United States, a little more complicated because we are the world's largest economy, and the virus has several fronts if you see it as a war. One is the biological impact, the other is the economic impact, and then there's the psychological impact. And I think people are dealing with all three. A lot of people have been shut in their homes that just are ready to say, all right, I know there's biological risk, but psychologically I need to get out of my house. I need to do something. There are other people that have a business that are watching it slowly slip away, and they just are ready to take some risk on that front. And so I think those things are driving the United States. I do think we have pretty good testing too. And so, if you look at places like India, I don't know what the testing is like in India. They have bigger population, they have more density, and they likely have a whole lot of cases. But so I think those things drive it. I think China versus the United States is an amazing case study because the sort of control that the Chinese have over their population is far in excess of what the United States. The United States is the land of the free, and so this is coming. I do think there is some of that effect of people saying, it's my right to go and take some risk and to go out there knowing there is a virus. And there's something to that, but there's also something to protecting your neighbor.
When we talked last time, I was struck how you described you have family in the western part of the state, which is the more rural part of North Carolina. And they, I think, maybe had the impression that this is just going to be a problem in New York City and other big urban areas. And you were, I'm sure, in a diplomatic way, talking to family members saying, this is a bit of a time capsule, and 2 months from now, you may well experience some of what they're seeing in New York with, rolling up trucks to take care of the bodies. Has that played out in terms of the rural part of the state?
I think there's a different perspective on the virus. In the rural parts of North Carolina, the virus is not as present as it is here I live in Raleigh, North Carolina, is the state capital, and Wake County has about 1 million residents. And then we have Charlotte, which is obviously our biggest city. And so Raleigh and Charlotte and then Greensboro, to a lesser extent, are the most affected places in the state. But yeah, definitely in the rural parts, I think they're taking it seriously because they know someone who has had the coronavirus and has been to the hospital for it now. I think that is what really makes it real for people. But I also think they, unfortunately now we're at a point in time where economically things have gotten worse. And I think people's resolve to fight the virus has weakened a little bit.
Yeah. It's such an odd experience to see the differences in the country. When I look at the map, one map I saw, the green areas were where the cases were going down, and it was the Northeast and Maine where I am. It's one of the greenest of the areas. And then red was where the cases are going up. And I guess I'm confused at how that works, given how much travel there is throughout the country, that it's almost as if this thing is traveling by the Pony Express and it's taking a long time to get distributed. But how do you understand the differences in just how the case load is showing itself in different parts of the country?
I mean, I think there's a few things. One here is that in the South, you have more naive populations that haven't been exposed to the virus that are now being exposed. So it's sort of like in New York City, there are less hosts that don't have antibodies, that haven't seen the virus. So there's like, in viral propagation, there are these sort of thresholds over which, once the virus infects this many hosts, then it can really amplify in a population. And if it's below that threshold, it tends not to thrive. And so I think apparently in the Northeast, you've got some psychological changes among the population. You got a ton of people walking around with antibodies, and you have a ton of people that really legitimately have changed their behavior. They're wearing masks. They're more cognizant of washing their hands. And in the South, you have a lot of people that felt like they were locked up in their homes because there was a problem in New York City. Whether that is the right conclusion or not, that is how I think a lot of people feel. And so I think all these factors are coming together, right? Like if you had it to do over, there's all sorts of things you could have done differently, which is not had such a strenuous lockdown in the South and maybe let the air out just a little bit at a time. Alternatively, there's tons of things that could have been done that would have helped a lot, which, you're sending people checks for $600. I mean, you could put a pack of masks in there for a few more dollars. I don't know what the mask would have cost. Let's say they're $6. And that's now 1%. And economically, you would have saved quite a lot of money and just said, here's a United States of America issued mask made in America, support the economy, wear it.
Yeah.
It was a pretty easy one, but
what about 2 months from now? It feels like we're sort of at a fork in a road where maybe the country can come together and the president is wearing a mask. There's sort of a route, an off ramp to this versus continued gridlock or whatever. If you were writing this story, what would be the plausible plot twist between now and September?
Yeah, I mean, I'm actually reasonably optimistic. I mean, I think enough people, it feels like, are taking it seriously. I mean, we're in North Carolina, we're certainly seeing our curve continue to go up. We're just right on the threshold of hospitals starting to get a little concerned about capacity, right? But we've got a lot of things going for us. I mean, I think a lot of these vulnerable populations, I think, are now really taking it seriously. Even people who I think were not in favor of the lockdown now sort of, say, let's wear a mask and let's do some things that are reasonable that really can't hurt you a lot, right, to wear a mask, but it could help some people a lot. And so my expectation is that in 2 months, we're sitting at July, August, September. In 2 months, you've had about a month of school. And so if in the first week or two of school, things get really bad, then we're in another lockdown situation. But I actually think things are going to be a lot better in 2 months. And there's a lot of things that are really going well. Like they're starting to identify some treatments that seem to be somewhat effective, and they have some pretty good vaccine candidates. So I'm pretty optimistic. Like I think we'll be in potentially better shape.
That's good to hear. Well, one of the treatments that was in the news right about the time we talked was remdesivir, created by Gilead Sciences. And actually, Dr. Fauci himself was talking about it at a White House briefing I saw, and it looked like it was showing clear-cut, significant positive effect in diminishing the time to recovery. I haven't seen much in the news since then, but are those tests still looking pretty promising for that treatment?
I think they've had a few good readouts. The sample sizes I've seen are pretty small, and then it's a question of what was the condition of these patients when they were put on the medication. And so, some of this data is going to be, what you really need is a large scale study of people all across the spectrum of, are they just now entering the ICU, or they've been in there for 2 weeks. But yeah, I think that looks pretty promising. And I've seen a few other things. So there was an Israeli scientist who, they did a study and they felt that the virus was more or less like most coronaviruses, but in some patients, it altered the way lipids attached to the lung cells, which I thought was a really interesting theory. It could start to explain a lot of things. And lipid metabolism is different in every human body, but generally, if you don't have a lipid disorder, you are able to maintain your weight a lot better. You don't have as much coronary artery disease. But people, who have these lipid problems, or, either, very high cholesterol, or their low density lipids are misformed or something, they have all sorts of problems. But, that to me would be an avenue to really explore, because they used I can't remember the name of the drug, but it was like a Crestor or Lipitor, something that altered lipid metabolism, and they had a good response in some of the patients that used it on. But those are the kind of things that I think would be really interesting to look at.
Now, on the vaccine front, the number of vaccines, there's a Wall Street Journal article I read today, 160 vaccines under development, 21 being evaluated in clinical settings. But still, this article was saying the soonest it'd be likely to be deployed would be 12 to 18 months from now. But just the scale of that, I think, compared with the number of vaccines that were developed in 1984 for HIV, it just was nowhere near the scale of the vaccine development that we're seeing in the wake of this.
Yeah, I mean, it's a ton of vaccines. And then I think there's a lot of questions around, there's a reason you get a flu vaccine every year, right? The flu virus mutates. There's not really a reason to think that this virus won't mutate. And also, how durable is the immunity, the antibodies, do they persist? And coronavirus is, notoriously hard to treat. That's why you get a cold every few years. But I think I'm probably more encouraged by treatments than a vaccine. Vaccines it's hard to get people to take them, even if they need them. And then, just all kind of, but alternatively, if you've got a treatment and someone gets sick and they come in and you say, okay, this is someone that is in this category, we know these treatments work, and you just have A, B, C that you try.
Yeah.
And that I think is pretty exciting.
I've noticed that compared with back in March when we first came up here to Maine, we were very conservative about having contact with family members or anybody. But now the summer season has started. We've got some family members who have shown up, including my grandsons. And at each time I've found out that, for example, my daughter, who has the 6-year-old and the 4-year-old boys, been very cautious, very conservative. They haven't, been out to any bars or anything, and been very cautious in shopping and everything else. So when they showed up, it was sort of welcome to our bubble. We were just deciding that we're not going to stay 6 feet apart. And when we're together, we're just going to be together. We tended to try to stay outdoors as much as possible. I think that was something that just seemed natural. Have you had a similar kind of deciding how big your bubble is in terms of family and friends and the people you're in contact with? Or you're an introvert who in some ways is enjoying this amount of isolation, I'm sure. But your wife and your daughter are there. And how much has your bubble expanded in the last couple of months?
Well, it's certainly expanded, like you said. I think it's kind of like taking these baby steps out. For me, things have really not changed much at all. If anything, I've found that more of my writer friends want to get on Zoom and talk and be social, which is not something you typically associate with writers. But my wife, we have a almost 4-year-old daughter, and now we let one of the neighbors' daughters who's home from college watch her. And, the neighbor next door has a 2-year-old son. And so, we try to take practical precautions. I mean, so the neighbor, we rented a house at the beach, and, we didn't go out anywhere, brought our food, got groceries delivered. And the neighbor's son, visited when we were down at the beach. And then when the neighbor's son went back to preschool, we gave a little time, there for safety reasons. And then now we're letting them play together. And then, our daughter goes to a Montessori preschool, and Anna and I have talked about it. And our plan is to, let her go back to school, but to quarantine her from her grandparents for 14 days. And then once that is done, if she doesn't present with symptoms and we're asymptomatic, we would reintroduce the grandparents. And so I think it's just, for us, it's been balancing psychological health with biological risk. And like you said, I think everyone in America is doing that, and is just trying to be as conscientious as you can. I'm
surprised sometimes because I have this illusion that we're the only people living in this kind of isolation. And then there's a guy I follow, Baratunde Thurston, who's a kind of a commentator, comedian, writer in L.A. He's been spending the last 3 months pretty much exactly the way I have. He's been in a room. He's been Zooming. It's amazing to think of, 300 million people in this country living this way, so radically different than the way we lived before. I think in some ways I'm surprised that people aren't just going crazy, that there hasn't been a total mental breakdown of the population. And in fact, what happens is people just kind of get used to it, and they complain about how many Zoom calls they had today, but then they get pretty good at muting themselves. And it just sort of transitions into an entirely different way of living.
We're, I think, the toughest country, or sort of what we're going through is anathema to the American way of life. We are all immigrants here, from at least 300 years back. And then, there's a reason that we ended up in the new world, as some of our ancestors wanted to find something new and start something new. And they had a sense of adventure. And I still think Americans feel that way. Like they want to get up in the morning, go out and conquer, and, to a certain extent, experience something new or create something. And I think being holed up in your house is not exactly that.
That's not what we had in mind, is it?
Not even close. Yeah. But people are adaptive. And I think the American sort of way of life is to adapt. So I think it's been tough, but I think we've done, on the psychological front, I'm, pretty encouraged. You look at some of the stows, an article on WRAL.com today, is our local news here, and it said that, drug abuse and alcohol abuse treatment centers are seeing a 20% uptick. Yeah. And those are the sort of things that you would expect. And it feels like, governments really need to provide for that as well, because that's sort of a side effect, I think, of the lockdown and the pandemic. And it's a real need just as much as ventilators.
Yeah. There's some news that's come out in the last few days. WHO has revised its language around airborne transmission, saying it cannot be ruled out at this point. And this is something I think you mentioned way back in March, that you suspected that we were going to be realizing that this could be transmitted through the air. And that makes me think of airplanes, because Darlene's sister lives in Omaha, and, she loves to come out here to the beach each year. And we're thinking, gosh, in September, is there anything that changes so that she would actually risk getting on a plane in Omaha and changing in Chicago and flying out here, especially if there tends to be more science on the risk of the virus traveling in smaller particles, therefore further than 6 feet, and just in a plane in an airport, it being more dangerous than we even kind of have accepted that it is now to transmit it that way.
I'm actually, there's tons of things that surprise me about all this, but there has been, I sort of expected us to know more about the virus at this point. Like, the infection rates are obviously consistent with an airborne virus, and one that that has small particles that tend to hang in the air. I mean, so if it's airborne, is it just person to person, or is this thing really, do you need to be shutting off your HVAC? And airplanes would be a concern, right? It doesn't, so hard fomites, how long can the virus survive on metal and cardboard and all these things? And sort of like some of this stuff is pretty easy to sort out. I mean, you just get in the lab and you find someone who's infected, and in the Boston area and even, Durham, North Carolina, we've got a lot of infected people that, are infected but still reasonably healthy. I mean, you literally could just run an ad in the paper or online on Facebook and say, participants wanted, Duke University, here we are, go in a room, breathe, and we have these surfaces, and we sort of calculate how far the particles can go. And I mean, I haven't really seen, maybe the studies have been published, but I haven't seen them. But it feels like we should know, some of this stuff, right? But,
yeah.
It still feels like a lot of unknowns.
Yeah. Is it changing even as we're trying to learn about it, or new strains, or how much of a moving target is it?
Hard to say. I mean, some viruses are obviously a lot more stable than others. And I think the more host a virus, the more people a virus infects, the more likely you are to see mutations, viral vectors, and things like that. So, I don't know. I mean, that's also hard to say. But I mean, if you ask me, the most likely, if I had to lay odds, I would say this is probably the same virus that's infecting healthier people. And you also have hospitals that have seen a bunch of cases and are maybe trying, either was remdesivir or, somebody was using I think it was a corticosteroid or some anti-inflammatory like that, that seemed somewhat effective. So, yeah.
Yeah. Do you have a novel that is gestating that's set in a situation like this yet?
No, I've actually shied sort of away from the end of the world. The novel I'm writing right now is set on the moon, so which is where I think a lot of people would like to go right now.
Is it post-apocalyptic or just sort of upbeat sci-fi?
Well, it's strangely sort of like the real regular world right now. I don't know if you consider, I don't know where you put down the continuum of normal.
The only place normal exists is on the moon in that scenario.
Yeah. And it gets crazy up there too. So.
Well, yeah, wherever two or three are gathered together.
Right.
Well, good to see you're still there, and I value your optimism because I think given your knowledge of the topic, you're reading the same dire stories that I am, and when you can come out. I would perceive you that you're at least 30% more optimistic than I am right now, and that's a good indicator.
I want to convey some of that optimism. Yeah. I don't know. Time will tell whether it's well founded or not.
Yeah.
But.
I have been speaking with A.G. Riddle, author of Pandemic and Other Science-Based Thrillers. Thanks very much, Jerry.
Thank you for having me.
Before we go, I want to mention that you may have noticed that I switched back to the usual order of things by having the news followed by the tech tip and the interview. I had been experimenting with running the interview first because sometimes I feel like if I've talked with someone and they want to put the interview in front of their listeners, it's handy to just be able to start listening to the interview from the start of the show. But I heard an altogether different perspective. I was grateful to hear from a listener, Paul Tribble, and he wrote me, Len, for what it's worth, I prefer having the news and tech tips at the beginning of the podcast, just one man's opinion. Paul's from Atlanta. So I was curious about that. I said, could you tell me a little bit more why you prefer that original sequence? And he wrote back, I'm always interested in hearing about Kindle news and tech tips and will listen to them until their completion. I will always begin listening to your interview of the show guests, but only listen all the way through about half the time. I find that I am attuned to the interests of some of your guests and some not so so much. If I'm short of time, I will listen to the Kindle News and Tech Tips and skip the interview. That makes a lot of sense to me because, I'm interviewing people because I want to talk to them, but my taste and who's of interest, it would be miraculous if everybody listening thought, oh boy, another guest that I can't wait to hear from. They're in Paul's case, half of the guests are sort of ho-hum and not worth the time listening to. So that makes a lot of sense. And in that case, if I had the material which is most likely to appeal to most listeners first, tech tips, that's always popular. I know that when I can put something in front of this audience that helps you to use your Kindles, and it might even be that if I switch some of the content ideas, that if I'm gathering the things that perhaps define the overlapping interests of this audience that's now been, established for 12 years or so, and then have the interview just be something that, if you're interested in it, you can listen and you'll know there won't be anything at the end of the show that you might miss. You'll just be able to decide whether to stick with the interview or not. So if you have any thoughts on this, I'd love to find a sweet spot of doing this. And if I had to choose between the convenience of my guests and the convenience of my listeners, I think I'd rather go with the listeners. So it's possible I'm going to return to the original lineup here based on Paul's thoughtful comment. If you'd like to weigh in, please send me an email at podchronicles@gmail.com. I don't have a guest yet for next week. I'm still waiting for the person I invited for the interview on July 26th to get word back. I'm afraid the trail seems to be going a little cold. The woman that I had initially reached out to, and I gave her a follow-up saying, any news, I got an auto reply that she was on vacation for a while until after July 26th. So it's not going to surprise me if in the midst of everything, Jeff is not going to be able to honor his quadrennial commitment that probably exists only in my mind, but it sure would be a thrill to hear from him. Even just a 5-minute, hello, Kindle Chronicles listeners, this is Jeff. So anyway, I haven't given up hope we'll hear Jeff on the 12th anniversary episode, but I need to think up something. I may just invite Baratunde Thurston back because he was my first guest, and just think of that, 12 years ago, and I've been following his work in the midst of the pandemic and all else that is going on, and it might just be time to see if he can come back and we can review the past 12 years of our reading and technology and the things that have been of interest, in including the current state of the world. But or if all else fails, you might be hearing Darlene on the anniversary episode, and I think sometimes she attracts more listeners than Jeff Bezos anyway. For sure, there will be a show, and I hope you'll join me. Thanks for listening. Bye.